On to the next speaker, that is Dr. Sihuti Agnihotri.
Today my topic of discussion is comparison of post-operative analgesia with caudal block using 0.2% ropivacaine and 0.25% bupivacaine in lower abdominal and perianal surgeries. Pain. Pain has been defined as an unpleasant, sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. There is a misconception that infants and children do not feel pain or remember it. However, it has been proved that infants and children do feel pain and remember it. Secondly, it is difficult to assess pain in infants. The methods of pain relief: continuous IV infusions of NSAIDs and opioids, patient-controlled analgesia and regional blocks can be applied. Caudal blocks have been used successfully for anesthesia and post-operative pain relief in children. In children, the sacral hiatus is usually very easy to palpate, thus making the procedure very simple. Relief of pain in the early post-operative period is probably the major advantage of caudal anesthesia in small children. Caudal block has the following advantages: it is safe, it is easy to perform in children, it has reliable results, and it requires no special equipment. Duration of pain-free period is more, and it is applicable to children of all ages, including neonates. Ropivacaine. Ropivacaine is a S-enantiomer of bupivacaine, alleged characterized by less motor blockade, less neurotoxicity, and less cardiotoxicity, similar analgesic properties when compared to bupivacaine. Based on the above results, we thought of comparing the analgesic efficacy of caudal administration of 0.2% ropivacaine and 0.25% bupivacaine in post-operative pain after lower abdomen and perianal surgeries. Aim and objectives. Our aim was to compare the quality of caudal analgesia using 0.2% ropivacaine and 0.25% bupivacaine in lower abdomen and perineal surgeries. Objectives: to compare the duration of post-operative analgesia, to compare the incidence of motor blockade, to compare the side effects and any complications. Material. The study was done in Bharti Hospital after taking approval of ethical committee and taking written informed consent from the parents. The patients were randomly allocated into two groups containing 30 patients each. Group B, bupivacaine 0.25%, 1 ml per kg. Group R, ropivacaine 0.2%, 1 ml per kg. The children who were included were children between 1 to 6 years of age, ASA 1 and 2 status, scheduled for elective surgeries, surgeries of below umbilical region. Excluded patients: patient with history of allergic reaction to local anesthetics, bleeding diathesis, pre-existing neurological or spinal disease. Standard general anesthetic techniques were applied. Patients were pre-medicated with injection glycopyrrolate, IV 0.004 mg per kg. Patients were induced with injection thiopentone 5 to 6 mg per kg and intubated with injection succinylcholine 2 mg per kg. Maintained on oxygen plus nitrous oxide plus sevoflurane, and injection vecuronium was given intermittently 0.08 mg per kg plus injection fentanyl 1 microgram per kg. Caudal block was achieved in left lateral position before reversal. Injection in reversal, we took injection neostigmine 0.04 mg per kg and injection glycopyrrolate 0.01 mg per kg. Now these are the we took the children. The mean weight was not significantly changed. There was no significance, not much change was there. And in the mean age, the age was also comparatively similar in both the groups. Mean heart rate. What we observed was that there was no major changes in the heart rate of both the groups. The mean systolic BP, there was no significant changes in both the groups. The mean visual analog score, what we observed was that in both the drugs, we required the rescue analgesia at the 8th hour. So we were observing the patients from 0 to 12 hours after giving the caudal block. Now, adequate pain relief, it's an extremely important aspect of post-operative care. This is important not only for the psychological well-being of the patient, it also decreases the stress response to surgery and favors a better outcome. Similar studies were done by Dr. D.S. Brockway and J. Bannister and et al. Carried out a study of comparison of extradural ropivacaine and bupivacaine 0.5% and 0.75%, and they found little difference between the two groups with respect to speed of onset or sensory block. Ropivacaine produced a slower onset, shorter duration and less intense motor block than same concentration of bupivacaine. The cardiovascular changes were similar in all the groups. Ropivacaine is a longer-acting local anesthetic agent with less motor blockade and less cardiotoxicity than bupivacaine. In 2000, P.A. Longquest, Western et al. Studied the pharmacokinetics of ropivacaine after caudal block in 1 to 8-year-old children and found ropivacaine to have better results. The assessment of pain was done for 12 hours post-operatively with VAS score and objective pulse, parameters like pulse rate, blood pressure, which I have shown in the tables. All our cases were operated under general anesthesia. Then a study was conducted by Herbert, Kunin, Klaus, Chekrin et al. Compared 0.5% bupivacaine versus 0.25% ropivacaine and 0.25% bupivacaine. No difference was found between 0.25% bupivacaine and ropivacaine 0.25%. All groups showed a significant decrease in MAP and heart rate from baseline values, but difference between our groups were not observed. Conclusion. In our study, 0.2% ropivacaine and bupivacaine at concentration of 0.25% produced reliable analgesia in all children with virtually no complication in any patient, indicating that both drugs can be recommended for pediatric caudal block. The motor block induced by ropivacaine was less than bupivacaine. No adverse events due to local anesthetics were seen in either group, a finding which combined with its less cardiotoxicity makes ropivacaine a drug worthy of continued investigation. In conclusion, the result of this study confirmed the suitability of ropivacaine for extradural anesthesia. These are my references.
As I said, in the interest of time, we move on to the next speaker.